Is creatine really safe for people over 50, 60, or even 70 years old? More than 80% of people over 60 suffer from significant muscle loss, a phenomenon known as sarcopenia. This loss isn't just aesthetic, but seriously compromises quality of life, increasing the risk of falls, fractures, and loss of independence. Many expect this decline to be inevitable with aging, but modern science demonstrates we can effectively combat it. We don't need to passively accept the frailty that society normalizes for the elderly. Today you'll see how creatine can be a powerful and safe ally for those over 50, 60, or even 70 years old, demystifying concerns and revealing benefits that go far beyond muscles. Before we begin, tell me in the comments your name and how long you've been training. What is creatine? Creatine isn't a foreign element to our body. On the contrary, it's a substance our own body naturally produces. Formed by 3 amino acids, glycine, arginine, and methionine, it's synthesized mainly in the liver, kidneys, and pancreas. In the body, creatine plays a fundamental role in energy metabolism, especially in muscles and the brain. When we talk about energy for quick and intense muscle contractions, creatine is the protagonist. It forms phosphocreatine, a compound that helps in the rapid regeneration of ATP, adenosine triphosphate, our cellular energy currency. It's as if creatine were an ultra-fast recharge battery for our cells. The problem is that our body produces only about 1 gram of creatine per day, an insufficient amount to experience its complete benefits, especially as we age. This happens because, with age, both natural production and absorption of creatine from food tend to decrease. Foods containing creatine are mainly of animal origin, such as red meats and fish. A 7-ounce steak contains approximately 1 to 2 grams of creatine. To obtain the recommended 3 to 5 grams daily, it would be necessary to consume substantial amounts of these foods every day, which isn't always practical or healthy. That's why supplementation with creatine monohydrate becomes an efficient option to ensure optimal levels in the body, especially for people over 50. Unlike other supplements that promise a lot and deliver little, creatine has decades of scientific research proving its effectiveness and safety. Myths about creatine. One of the biggest barriers for many people, especially older ones, to start creatine supplementation are the persistent myths that have circulated for decades. Let's demystify the 2 main misconceptions. The first common myth is that creatine causes hair loss. This fear is particularly common among older men, who may already be dealing with natural hair thinning. The origin of this myth is related to a single study that suggested creatine could increase levels of DHT, a hormone associated with male baldness. However, it's crucial to understand that that study had serious methodological limitations, and its results were never reproduced in subsequent research. Dozens of more recent and well-controlled studies have found no relationship between creatine use and hair loss. What we know for certain is that genetic factors and natural aging have a much greater impact on hair health than any supplement. The second persistent myth is that creatine harms the kidneys. This concern is particularly relevant for older people who naturally may have concerns about kidney health. The confusion arose because creatine is metabolized into creatinine, a substance whose levels are measured in blood tests to evaluate kidney function. The elevation of creatinine after creatine use is a normal physiological effect and doesn't indicate kidney damage. It's as if we were confusing the thermometer with the fever. Several long-term studies, including some with people over 60 and even patients with mild kidney disease, have demonstrated that creatine supplementation at recommended doses doesn't cause any damage to the kidneys in healthy individuals. It's important to emphasize that people with severe kidney disease should consult their doctor before starting any supplementation, not just creatine. This recommendation applies to any supplement, not because of specific risks of creatine, but as a general precaution for those with significant kidney impairment. Benefits of creatine. When we think of creatine, the first image that comes to mind is usually young bodybuilders seeking bigger muscles. However, for people over 50, the benefits go far beyond aesthetics and can represent a significant difference in quality of life. The increase in muscle mass is indeed an important benefit of creatine, especially considering that we naturally lose about 3 to 8% of muscle mass per decade after 30, a process that accelerates after 60. Creatine helps retain water inside muscle cells, creating an anabolic environment that favors protein synthesis. In combination with strength training, studies show that people over 60 supplementing with creatine showed significantly greater muscle mass gains compared to those who trained without supplementation. But perhaps more important than muscle size is the increase in strength provided by creatine. Research demonstrates increases of 5 to 15% in maximum strength in elderly people after a few weeks of supplementation combined with training. This strength gain isn't limited just to leg or arm muscles, but occurs throughout the body, including the core muscles responsible for stability and posture. What many people don't know is that creatine also offers benefits for brain health and cognitive function. After 50, the brain begins to face metabolic challenges that can affect memory and other cognitive functions. Creatine helps provide energy to neurons, potentially improving memory, attention, and information processing. Some preliminary studies suggest that supplementation may even help protect against age-related cognitive decline. A less discussed but potentially revolutionary benefit is the support that creatine offers to mitochondria, our cellular power plants. The decline in mitochondrial function is one of the main theories about aging. Creatine helps preserve mitochondrial integrity and energy efficiency, potentially contributing to cellular longevity and, by extension, to healthier aging. Additionally, recent research suggests that creatine may have anti-inflammatory and antioxidant effects, helping to combat oxidative stress that increases with age. This effect may contribute to reducing the risk of various chronic diseases associated with aging. For postmenopausal women, creatine can be particularly beneficial, helping mitigate accelerated bone and muscle loss that occurs during this period. Preliminary studies indicate that supplementation may contribute to maintaining bone mineral density when combined with resistance exercises. Before we continue, don't forget to subscribe to the channel. Having constant access to science-based information is what will help you progress with long-term health in the world of bodybuilding. Essential care when using creatine. To get the maximum benefit from creatine, especially after 50, some precautions are fundamental and often neglected, even by people who have been using the supplement for years. The recommended daily dose is 3 to 5 grams per day, regardless of your body size. There's no need for larger doses, as they won't bring additional benefits and may unnecessarily overload the digestive system. A common mistake is believing that creatine should only be taken on training days. In fact, to keep muscle levels saturated, it's important to consume creatine every day, even on rest days. The loading phase question, taking 20 grams daily for a week, is optional. For older people, I recommend simply starting with 3 to 5 grams daily and maintaining that dosage. The result will take a few more weeks to appear completely, but it eliminates possible gastrointestinal discomfort that larger doses can cause. A crucial aspect that few know is the importance of consuming creatine accompanied by carbohydrates. The presence of insulin in the blood, stimulated by carbohydrates, significantly increases the uptake of creatine by muscles. A simple banana, a slice of whole grain bread, or even a little fruit juice along with creatine can make a big difference in the efficiency of supplementation. Another essential precaution is increasing water intake. Creatine attracts water into muscle cells, which is part of its positive mechanism of action. However, this means you need to consume more fluids to stay properly hydrated. For people over 50, who already tend to have less sensation of thirst, this point is particularly important. An increase of at least 17 to 34 fluid ounces in daily water intake is recommended. The quality of the supplement is a factor that cannot be neglected. The supplement market isn't as regulated as the pharmaceutical one, and low-quality products may contain less creatine than declared or even contaminants. Very cheap products frequently have questionable purity. Always prefer recognized brands with quality certifications and that use monohydrated creatine, the most studied and effective form. Remember that economy in supplement quality can mean not only waste of money, but potential health risks. The time of consumption, contrary to what many believe, isn't critical. Some studies suggest small advantages in taking creatine close to training, before or after, but the differences are minimal. The most important thing is daily consistency. Choose a time that's easy to remember and maintain as a routine. Finally, For people with pre-existing medical conditions or who take medications regularly, it's prudent to consult a doctor before starting supplementation. Not because creatine is dangerous, but to ensure there are no specific interactions with your clinical condition or ongoing treatments. Is creatine safe for the elderly? The central question many ask is, after all, is creatine really safe for those who have already passed 50, 60, or 70 years? The short answer, based on decades of scientific research, is yes, with some important considerations. Creatine is one of the most studied supplements in the history of sports nutrition, with thousands of studies attesting to its safety for various populations, including the elderly. Specific research with participants over 60 has demonstrated that creatine supplementation at recommended doses doesn't present significant short or long-term side effects. A study published in the Journal of Gerontology followed elderly people supplementing with creatine for more than a year and found no negative changes in markers of kidney, liver, or cardiovascular health. In fact, participants showed improvements in muscle mass, strength, and functional capacity compared to the group that didn't receive creatine. For people over 50, creatine can be especially beneficial when combined with strength training. The combination enhances exercise results, allowing the practitioner to perform more repetitions with greater load, which further stimulates muscle growth and preservation. This synergistic effect is particularly valuable for combating sarcopenia, age-related muscle loss. It's important to emphasize that in some specific cases, additional precautions should be taken. People with advanced kidney disease should consult their nephrologist before starting supplementation. Similarly, individuals with serious heart conditions or uncontrolled blood pressure should discuss the use of any supplement with their cardiologist. An often neglected aspect is that creatine may be even more important for elderly vegetarians or vegans. As the natural source of creatine comes mainly from meats and fish, people who don't consume animal products have naturally lower levels of this compound. In these cases, supplementation can bring even more pronounced benefits. For postmenopausal women, who face increased risks of osteoporosis and muscle fragility, creatine combined with exercise can be a valuable tool in maintaining independence and quality of life. Studies show that elderly women respond well to supplementation, with gains proportional to those observed in men of the same age group. When we talk about safety for the elderly, it's important to consider not only the absence of risks, but also the risks of not supplementing. The loss of muscle mass and strength with advancing age isn't just an aesthetic issue, but a determining factor for independence, mobility, and even survival. Muscle fragility significantly increases the risk of falls, which are the main cause of injuries and hospitalization in people over 65. In conclusion, creatine is not only safe for the elderly, but can be considered one of the most recommended supplements for people over 50 who wish to stay strong, independent, and with good quality of life as age advances. Many specialists in geriatrics and sports medicine consider it the best available supplement that really makes a measurable difference in the health and performance of the elderly, with an extremely favorable safety profile. Contraindications. Before we finish, it's important to talk about some contraindications. Remember that the goal of supplementation is to improve your body and health, not compromise them. For people with severe renal insufficiency, in stages 4 and 5, creatine supplementation should be avoided or performed only under strict medical supervision. In these cases, the kidney already has difficulty processing proteins and nitrogenous compounds, and creatine may represent an unnecessary additional burden. If you have a history of kidney disease, even mild, consult your nephrologist before starting use. Individuals with advanced liver diseases should also be cautious, as the liver participates in creatine metabolism. In these cases, a prior medical evaluation is essential to determine if supplementation is appropriate. People who suffer from chronic migraine may, in some rare cases, experience an intensification of crises when using creatine. If you notice this correlation, discontinue use and consult a neurologist. For uncontrolled hypertensives, although creatine doesn't directly cause elevation of blood pressure, water retention in cells can, theoretically, have some impact on pressure in specific cases. The ideal is to stabilize blood pressure before starting supplementation, or do so with regular monitoring. In all these cases, there are alternatives that can be considered, such as whey protein or essential amino acids, which also contribute to muscle health, although they don't offer exactly the same benefits as creatine. If you liked this and are willing to start taking creatine, we leave a video appearing right now on the screen showing other mistakes you should avoid when consuming this supplement, to prevent its potential from being thrown in the trash, and also to avoid damage to your body. Be sure to check it out. Thank you for watching this far, and may God bless you, my friend.